Hi, everyone. Welcome to Springer Nature's Q1 2022 medical titles recording. We are so excited to present to you our key titles in the clinical medicine field from Springer Nature. Our books have been selected by our sales team and editorial team, so these are the highlights for the upcoming season. All right. So our first title in clinical medicine highlights is Pediatric Diagnostic Labs for Primary Care. Interpreting the results of children diagnostic laboratory tests requires knowledge of their biochemical and metabolic differences. This textbook provides nurses, physician assistants, medical students, and residents with that latest information, questions, and case studies to help them order appropriate lab tests for pediatric patients and to understand how to interpret them to improve their diagnostic reasoning. So, key concepts in this book include sensitivity, specificity, positive and negative predictive values, as well as indications for diagnostic lab tests. Okay, and coming up, we have our nursing books. We have 3 key titles for Q1. The first we have here is valvular heart disease. To date, there has been little emphasis placed on the management of valvular heart disease in cardiovascular nursing and allied health. This book fills the need for a go-to guide on the care of patients with acquired valvular heart disease. It includes unique information about heart valve anatomy and pathophysiology, the complexity of clinical presentations and diagnostic evaluation, patient education and shared decision-making, surgical and transcatheter treatment options, and transition to palliative care. The editors of this book are the international leaders and the pioneers for developing the care, management, and program of patients with valvular heart disease, so there is a very good authorship here. The next title we have is Nursing Informatics in the 5th edition. So Nursing Informatics is a top performer within the nursing discipline here at Springer Nature. Our 4th edition sold over 4,000 copies so far and has 90,000 downloads. In the 5th edition, Nursing Informatics speaks to nurses, and in a departure from earlier editions of this title, it will also be helpful for health professionals and direct patient care. So we're thinking here physicians, therapists, pharmacists, dietitians, and many others. This new edition of the textbook includes information on using informatics in a medical setting, informatics methods and tools, and it contains real-life case studies and other didactic features to illustrate the theories and the principles discussed. Our next nursing title here, actually this is pediatrics, Inborn metabolic diseases. So inborn errors of metabolism are rare genetic inherited disorders in which the body cannot properly turn food into energy. This disorder is usually caused by defects in specific proteins slash enzymes that help break down and metabolize parts of food. Within the last 5 years, a shift in our understanding of inborn metabolic diseases, also known as IMD, has changed the definition and concepts, paradigms, and classifications within this field. Now in its 7th edition, the concept of IMD is expanded to include disturbances in molecular machinery diagnosed by molecular techniques, but currently without measurable metabolic markers. A lot of good information here. There's also 2 new chapters that were added to describe 600 disorders of nucleic acid metabolism, tRNA metabolism, ribosomal biogenesis, and cellular trafficking. The previous editions have sold very well for Springer Nature in the past, and it's recognized as the standard textbook for professionals involved in the diagnosis and management of IMD. Pediatrics, pediatricians, neonatologists, biochemists, geneticists, and neurologists will appreciate this new 7th edition. And over to Mart.
This next book uniquely provides a comprehensive and up-to-date overview of congenital and acquired deformities of the pediatric shoulder girdle, a field barely covered in existing books. Supported by 140 illustrations, 81 of which are in color, and access to extra online files, Congenital and Acquired Deformities of the Pediatric Shoulder Girdle will be available in late February. The treatment-oriented structure of this book will appeal to experts and residents alike, including pediatric orthopedic fellows and attending surgeons, as well as general orthopedists, primary care doctors, and physiotherapists with an interest in the pediatric upper limb. The doctor, author Sebastian Farr, specializes in the field of hand and upper limb surgery and has spent time working in prestigious healthcare institutions around the globe, including Boston Children's Hospital. He's published 70 peer-reviewed articles as well as several book chapters previously, and notably served as the chair of the European Pediatric Orthopedic Society's Upper Limb Study Group between the years of 2017 and 2021. Next, please. Also filling a gap in the literature, 3D printing in bone surgery is the first book to comprehensively discuss this topic and a needed addition to the library of doctors looking to integrate this technology. It provides both the scientific basics and the practical applications for 3D printing for bone surgery, with a specific focus on custom-made titanium prostheses, which are used for bone reconstruction following tumor resection. 3D printing is increasingly being adopted in other fields of orthopedics as well, such as limb surgery, traumatology, and degenerative diseases. Throughout this book, experts from various fields share their knowledge, experience, and case studies relative to the reconstruction of different bone segments. This book is for orthopedic, neuro, head and neck, as well as myofascial surgeons wishing to gain insights into this new and promising field. The second edition of the Manual of Spine Surgery has been compiled in response to the rapid expansion of instrumented spinal surgery using minimally invasive and non-fusion techniques with a view to meeting the needs of spinal, orthopedic, and neurosurgeons. Here, the various open, less invasive, and minimally invasive techniques are presented step by step in a clear and instructive way with the aid of more than 600 high-quality illustrations. Precise definitions of indications and contradictions, technical and organizational factors, good operating technique, and correct perioperative preparation and positioning of the patient are carefully explained. This update takes into account the latest developments in spinal instrumentation and implants and new surgical techniques. This book is authoritative, concise, and portable, which makes it ideal for the use in a fast-paced clinical setting. Think of this as a daily companion for the spinal surgeon and others caring for patients with spinal disorders. Written by an international panel of experts, this next book, also on spine surgery, will be an invaluable tool for trainees of both orthopedic surgery and neurosurgery, and is also suitable for spine fellows and junior spine surgeons. Essentials of Spine Surgery is a concise textbook covering the full spectrum of spine surgery-related topics in a comprehensive yet readily accessible format. Addressing trauma, deformity, degeneration, oncology, and infections, both in pediatric and adult patients, it provides a broad overview of this complex surgical discipline. Each chapter exhaustively addresses a clinical problem, then narrows in on signs and symptoms, physical examination, differential diagnoses, classification, treatment options, possible complications, and follow-ups. In the book's appendix, the reader will find relevant classifications, indexes, questionnaires, and quality of life assessments. Didactical videos complement the book, illustrating essential basic spine surgery techniques. Climbing Medicine comprehensively discusses the medical aspects of sports climbing, a young but emerging sport that premiered at the Tokyo Olympics. Its rapid development from niche to popular sport has been accompanied by an increase in the number of climbing sports-specific injuries and has attracted growing interest within the sports medicine community. Gathering expertise from around the globe, the book covers all aspects related to this discipline, from physiology, biomechanics, and anatomy through upper and lower extremity injuries, as well as cardiology, gynecology, pediatric and adolescent conditions. Following a coherent structure, each chapter equips readers with an evidence-based diagnostic and therapeutic guideline. The clear text is enriched by a wealth of pictures, making this manual a timely and up-to-date resource for sports physicians, orthopedic surgeons, and traumatologists, as well as trainers, physiotherapists, and any other health professionals involved in the climbing business. The third edition of Eye Surgery combines the core principles and practices found in the first two editions with extensive updates from the last 2 decades, introducing a whole new generation of eye surgeons to the teachings of this classic text. Existing chapters have been completely revised and new chapters and extensive color illustrations have been added. Like its predecessors, the third edition presents clear and practical application and ergonomic and engineering principles that allows the eye surgeon to take advantage of the design instruments and techniques presented. Written and edited by leaders in the field, this edition preserves the character of the earlier publications and will remain an important reference for practicing eye surgeons. Over to Madeline.
Gynecological Endoscopic Surgery is an open access book, and it presents a comprehensive guide to gynecological minimal access surgery, a non-invasive procedure, with excellent medical illustrations. It takes the reader through the history of minimal access surgery, as well as the instrumentation and ergonomics required to progress in the field. It lays out practical steps that help the reader navigate the diagnostic and therapeutic applications of the surgery. The book is written by authors from 5 continents who combine their diverse experiences and perspectives into a comprehensive guide for practicing and trainee doctors. Musculoskeletal Radiology for Residents is a book that allows residents and specialists in radiology to assess and maintain their knowledge. It contains 1,000 practical questions with clear and concise explanations. This type of questions-based approach allows readers to problem solve and creates deep learning and thorough understanding of common clinical problems and the pathological processes in the bones, joints, tendons, and muscles. The book is unique in that it fills a need for comprehensive self-assessment to help practitioners stay up to date and ensure that they're prepared for all challenges they may face day to day. The Physics of Clinical MR Taught Through Images is in its 5th edition, and its objective is to teach through images a practical approach to medical resonance imaging, MRI technology, and image quality. Unlike other texts covering this topic, the focus is on clinical images rather than equations. So this provides a new perspective and is accessible to a wider readership because of its image-based approach. The book also emphasizes that understanding the technology allows for better quality images. The text has been thoroughly revised to include additional relevant clinical images, to improve the clarity of descriptions, and to increase the depth of the content. Musculoskeletal ultrasound in orthopedic and rheumatic diseases presents the major advances in technological updates in diagnostic ultrasound procedures, providing a step-by-step guide to performing an ultrasound evaluation. It explains the normal ultrasound anatomy with descriptions of rheumatic and orthopedic disease patterns that may be identified through ultrasound. And it also provides a chapter on the practical aspects of performing ultrasound-guided diagnostic and therapeutic interventional procedures on the management of drug delivery, which is an area that has had a tremendous impact recently. Radiology for PET-CT reporting is an atlas that's intended to enable nuclear medicine practitioners who routinely read PET-CT scans to recognize the most common CT abnormalities. Reading PET-CT scans can sometimes be challenging, and it's not infrequent to encounter abnormal findings in CT images, so understanding these abnormalities can impact patient management significantly. The book also offers an accessible guide to normal anatomy based on PET-CT studies, as well as an overview of common and uncommon anatomical abnormalities. The revised edition also includes new contrast CT information and guidance, which rounds out the coverage of PET-CT reporting.
All right.
Back to Jenny.
Thank you. So the next title we have here focuses on functional electrical stimulation. This allows muscles that have been paralyzed or partially paralyzed by stroke to move again. Very exciting field. This book explains to the therapeutic occupational group. So here we're thinking about physical therapists, occupational therapists, speech therapists, and interested physicians and clinicians. It explains to them the theoretical and practical applications of single to multi-channel functional electrical stimulation for a wide range of neurological symptoms. For the first time, experts from research and practice of FES have compiled numerous application examples based on the available evidence. An example of that includes the targeted electrical stimulation of several muscle groups timed to each other, which then initiate and support a complete movement sequence and thus improves motor learning. The chapters are also supplemented with videos on electric nerve stimulation of the muscle, stimulation of muscle groups in lower motor neuron lesions, and FES therapy approaches to dysarrhythmia and swallowing disorders. The next title we have is Atlas of Extreme Facial Cancer. This atlas shares the author's expert experiences in managing difficult facial skin cancer and presents rare cases from his own practice. The content in the book follows an anatomical approach based on the complex and often staged reconstruction of extreme facial cancer. It's written in a clear and logical format. It is intended as a guideline atlas and a surgical handbook, and it defines two principles. First, it's clear, which is the complete local excision of the cancer and aesthetic reconstruction, and drape, the second, which is delayed reconstruction after pathological examination. Both are free for reconstructing the face. The book also incorporates a wealth of multidisciplinary knowledge from surgeons, anesthetists, research scientists, speech and swallowing therapists, pathologists, radiologists, and much, much more. The surgical techniques here require a high degree of expertise. So this is targeted to professionals in the field of plastic, oral, and maxillofacial surgery, as well as dermatology. The next book is Men's Issues and Men's Mental Health. There are very few books out there on the subject of men's mental health and men's issues. However, there is a lot of writing on these topics on the internet by non-experts, mainly in the manosphere. So that's what we call a collection of websites, blogs, and online forums. So what that tells us is there is a market for an expert-driven kind of book on this subject. The aim of this book is to give an overview of men's mental health as well as related men's issues by adopting a public health approach that's an inspired approach examining the research that links social exposures and mental health outcomes in men. This book is unique in that it is a single narrative linking all of these issues together through the assessment of scientific and psychiatric literature. So this is an essential book for healthcare practitioners, social service providers, as well as psychiatrists, psychologists, social workers, occupational therapists, counselors, teachers, and more. This is also a book that can be read and understood by an intelligent lay reader, so a little bit more high level than general, but certainly accessible to the wider public. The next book we have here is Surgical Pathology of the Gastrointestinal System. The first volume, Volume 1, covers adult and pediatric GI tract pathology by providing practical advice on diagnostic pitfalls and differential diagnosis. This book covers each of the gastrointestinal tract pathology in detail, including clinical presentation, endoscopic appearance, disease pathogenesis, gross and microscopic details of each lesion. To accompany this book, there will be 800 photographs, line diagrams, endoscopic and radiology pictures, as well as microscopic images that are included to guide diagnosis. To reinforce the learning of the knowledge gained from each chapter, a summary and learning tips are included at the end of each to help guide readers. Chapters also contain case studies and multiple choice questions to self-assess on the content that's in the book. So anyone who likes to give themselves a pop quiz sometimes, this is the book for them. This comprehensive review of gastrointestinal pathology is a valuable resource for practicing pathologists, gastroenterologists, gastrointestinal surgeons, pathology fellows, postgraduates, and much more. We have here breast cancer radiation therapy. This book provides the essential information to improve the knowledge and skills of all healthcare providers involved in the treatment of patients with breast cancer. It draws information taught in courses combined with the author's broad clinical experience. It uniquely focuses on technical aspects and not general information that is included in other books on breast cancer radiation therapy. So this is truly a hands-on daily practice kind of book with the principles of radiation oncology included. Each chapter includes additional electronic supplementary materials, a short introduction summarizing the evidence in the literature with pearls. So these are short bullet point summaries. And it is also enriched by tables, figures, and illustrations to provide a concise and easy to follow format for all readers. This will be of interest to radiation oncologists, radiation technicians, and anyone who's in the field of radiology or involved in some way. And next, we have basic radiation oncology. So the previous edition has really good download numbers and sales numbers, and it's a really good title for practical use in this field. The second edition of Basic Radiation Oncology is an up-to-date all-in-one book encompassing the essential aspects of radiation physics, radiobiology, and clinical radiation oncology. The book has been designed to ensure that the reader will find it easy to use. Once again, a lot of those Pearl boxes, bullet pointed summaries, are used to summarize most of the information in this book, and there are more than 350 helpful illustrations, the majority of them in color, to guide the user. This will be extremely useful for residents, fellows, and clinicians in the field of radiation, medical, and surgical oncology, as well as for medical students and physicians in the field. And over to Mark for our next titles.
Thanks, Jenny. Recent Concepts in Minimal Access Surgery covers the recent developments in the area of surgery, which includes laparoscopic and robotic procedures. This is a fairly new branch of surgery that has advanced tremendously in the last few years. The text provides step-by-step descriptions accompanied by numerous helpful photographs and anatomical drawings. It also discusses criticism of these procedures and offers an opinion on recent changes in the technology available. It includes system-wise topics as well as meta-analysis of controversies. The book's intended audience is practitioners and faculty, as well as residents, trainees, and fellows learning about minimal access surgery. The Acute Neurology Survival Guide is a practical reference for trainees and advanced practice providers covering the essential management of hospitalized patients with acute neurologic conditions. This easy-to-use and visually accessible how-to manual covers exactly what every responding clinician needs to know in order to care for the patient in front of them. The first section provides tangible guidance about how to pre-round, structure a presentation, examine neurologically ill patients, and interpret the core diagnostics obtained, including CT, MRI, and EEGs. The next three sections cover common complaints encountered in the hospital, spanning from non-vascular admissions, vascular and stroke neurology topics, and core neurocritical care principles and chief complaints. Throughout are checklists, scoring systems, pro tips, images, helpful reminders, as well as a concise summary of pertinent literature. This is an ideal guide for medical students, neurology and neurosurgery trainees, and advanced practice providers, as well as experienced professionals who want to brush up on the latest updates in the field. This clinically oriented collection of brain imaging results provides a unique and helpful approach to epilepsy evaluation. Imaging of epilepsy is an atlas divided into sections according to general clinical categories. Each category includes a collection of clinical examples. Each example includes images across the relevant imaging modalities that relate to one patient whose history accompanies the image. The case-based organization with clinical history and multiple images offers a complete visual understanding of the imaging findings and the corresponding relationship of each finding to the clinical presentation, treatment, and outcome of the patient. Images for the book are from the UCLA Seizure Disorder Center, which is a referral center that serves a large outpatient population and performs approximately 500 inpatient epilepsy evaluations annually. Comprehensive and richly illustrated, this book will serve as a convenient resource in neurologic and radiologic practice and will also be very useful for board exam review.
Okay.
Sorry, Madeline, over to
That's
you.
okay. Gut microbiota, immunity, and health in production animals sheds light on the newest gut health research for food animal production, particularly swine, cattle, and poultry. It explains the relationship between microbiota and psychobiotic stress regulation. Gut health and microbiome research is an emerging discipline with broad implications. It's especially relevant to the livestock industry, of course, as it could lead to production increase, and it provides insights into sustainable animal agriculture and animal welfare. The insight this book provides into the chemistry of microbiomes also can impact veterinary medicine and environmental science. The Moral Case for Abortion is a second edition of a best-selling book, and the new edition includes a foreword from Dr. Willie Parker, a well-known U.S. abortion provider and reproductive justice advocate. It covers a particularly relevant issue as the Supreme Court heard oral arguments on Texas abortion laws a couple weeks ago and have yet to release their decision. The book approaches this hot topic by drawing on philosophical and sociological traditions to present the moral and ethical arguments for recognizing a person's right to reproductive choice. The new edition surveys the rapidly changing landscape of the abortion debate, including the rights of women in the aftermath of Trump's presidency, the debates on abortion in Ireland, the UK, and Europe, and the disparity in abortion access across the world.
Thank you, Madeline. And we have here to round out our presentation the latest titles coming on the subject of COVID-19. The first one we have here is cardiovascular complications of COVID-19. So we have seen that the proportional levels of cardiovascular and metabolic complications have tied to COVID-19. This book discusses that evidence and the relationship behind COVID-19 and heart disease based on the emerging state-of-the-art data. The next title here is Caring on the Frontline During COVID-19. So this one examines the experiences of global healthcare workers during the COVID-19 pandemic. It shines light on the healthcare workers during the pandemic, exploring their lived experiences of delivering care without losing sight of the symbolic nature of their work, but also the emotional toll. Drawing on data collected during the pandemic, the book explores global healthcare policies and healthcare worker experiences across 20 countries. And the last title we have on this slide is Nurses and COVID-19, Ethical Considerations in Pandemic Care. There's been a lot of talk around what the ethical challenges of COVID-19 have been. This one focuses on nurses, specifically how much risk should nurses be expected to accept during a pandemic, and it also answers other questions. It helps for nurses to learn from both the successes and failures that are affecting so many of them across the globe, including those on whom the public rely on to provide quality, compassionate, and expert care. So a great book for nurses who question what they need to do in their positions. And we have Springer Briefs. So our briefs are concise summaries of hot and emerging topics. It bridges the gap between published journal articles and contextual literature review. The first one we have is COVID-19 and health system segregation in the US. This one suggests remedies for racial and ethnic disparities confronting people of color amid COVID-19 in the United States. The next we have here is the recurrence of COVID-19 in New York State and New York City. So this is a follow-up from the author's previous brief, COVID-19 in New York City, an ecology of race and class oppression. That one showed that decades of discriminatory public policy shaped the Bronx into the epicenter for the first COVID wave. This one examines the buildup of the second wave across 62 counties in New York State and 150 zip code areas in New York City. So like the first brief, it will examine the vulnerabilities that gave rise to spikes in infection rates that formed these epicenters. And the last title we have is Vaccines, Medicines, and COVID-19. The health, economic, and social challenges that the world faced at the beginning of 2020 with COVID-19 continued, and unfortunately, in many parts of the world, worsened in the second half of 2020 and into 2021. This brief discusses the lessons of COVID-19 for the WHO, the World Health Organization, and the necessary measures that a reform of the WHO would have to take in order to implement a better rethinking of global and local manufacturing of medical products such as vaccines and the governance of health after a global pandemic such as COVID-19. So thank you everyone for your time and for checking out our Q1 2022 medical titles. If you have any questions or would like to reach out to us, feel free. We have our contact information left on the slides. Thank you.